Consideration of resolutions. Mr. Carpenter, would you please read the title of the Senate Resolution 5?
Senate Resolution 5 by Senator Lundberg concerning the Colorado Department of Public Health and Environment's proposed rule regulating the assisted living industry in Colorado.
Senator Lundberg.
Thank you, Mr. President. I move Senate Resolution 5, and I do not ask that it be read at length. I would just like to describe it briefly.
Please continue.
Thank you, Mr. President. Senate Resolution 5 is concerning the Colorado Department of Public Health and Environment's proposed rules regulating the assisted living industry in Colorado. This is the reason for this, that I bring this resolution before the body, is CDPHE is in the final stages of putting in place some regulations that are greatly concerning to many of the small assisted living facilities. And I have had this morning placed on the desk of all of the senators a letter that was written from one such owner and operator of actually two assisted living facilities, the smaller ones. These are the more the residential ones. This gentleman identifies himself as from Colorado Springs, and their concern is this may drive them out of business, literally, the regulations. And the resolution, as originally written, asks that the department not put those regulations in place at their board meeting, which is scheduled for tomorrow. However, I have also had some discussions with some of the members of the body here who have a resolution which will amend that down to simply asking that they give the small assisted living residences, that means the facilities with fewer than 20 beds, an additional 4 months to before they implement these rules, begging the department, and that's about all we can do, is beg the department to reconsider some of the more onerous and expensive components of these resolutions. Now, I also have an amendment to that amendment that would essentially lengthen that to 6 months. So that is a brief description of the problem, of the resolution, and of some of the resolutions to the resolution. This would be your time to amend that.
Any further discussion? There is an amendment on the desk. Mr. Carpenter, would you please read Amendment L002?
Amendment L002 to Senate Resolution 5 by Senators Aguilar and Cafalas. Amend printed resolution, page 1, strike lines 1 through 8. Strike.
Senator Aguilar.
Thank you, Mr. President. Members, we move Amendment L002. Members, we had the opportunity this year to hear a bill related to assisted living residences in our state. And I have to tell you that we actually were quite concerned about the inability of our state to provide adequate oversight and review to ensure that there's safety in them. And the bill we heard applied to large and small facilities. And so we were pleased overall to hear about the pathway the Department of Public Health and Environment was taking around these facilities. Because as you can see by the amendment, the complexity of patients being cared for in these non-nursing home facilities continues to increase as our population ages. And in fact, up to, I forgot the number, it's right here on line 18, up to 43% of them have Alzheimer's or some other form of dementia. And 6 out of 10 people with dementia, we know on average, will wander. And so safety is a real concern. Because our population is aging with so many people expected to be over the age of 60 and 85 in the future. And in fact, in these assisted living residencies, 57% of them are over the age of 85. We think that their need is critical, but we need to ensure that if our name is on it as having license or certify them, that the people in the facilities are kept safe. And I wanted to share with you a couple of stories that actually did happen in smaller facilities. There's 3 residents in a small 6-bed private pay facility, and they were typically put in bed at 8 at night and not checked again till 8 in the morning, so that in the morning they were found soaked in urine and would get some skin breakdown because of that, and wounds. One of them had wounds on their lower back. There was another resident in a small facility where there were just 16 people in the facility, and this resident had amnesia and dementia. And during the evening, unbeknownst to the staff, the resident left the facility and was found deceased at 2 in the morning outside of the facility. And so, again, these are small facilities, and these kinds of things happen. And so I think that the direction the department is taking is appropriate. The department has held many stakeholder meetings and has taken input and has, even as we speak, recently gone through and made modifications to try and accommodate the needs of some of the smaller assisted living facilities. But I think it's important that we recognize this as our responsibility as a legislature to ensure that these facilities provide safe care for our elderly and vulnerable populations. And so with the amendment, what we are saying is that we do want the Board of Health to adopt the rules. We do want to ask them to delay a little bit further the enforcement of the rules, and to and encourage the Board of Health, the Department of Public Health and Environment, to continue the work they've done on meeting with the small facilities to see what accommodations can be made that both ensure the public is kept safe and are not as much of a burden on them. And so we'd ask for your support for this amendment.
Senator Kafalis.
Thank you, Mr. President. Colleagues, I also rise in support of Amendment L002, and I just want to briefly provide a little bit of context here. My take on this resolution, or this amendment, strike below amendment, is that we're trying to strike a balance between making sure that the people that are being served in these assisted living residences, whether they're small or large, that they're receiving the proper care. And as was stated earlier, we're seeing that people being served have higher acuity levels. They have more complex needs, and so there is a real need to have a proper balance between safety and, at the same time, acknowledging that the smaller assisted living residences that serve 19 or less individuals, that they've raised legitimate concerns about costs and some of the regulations. And so I think it's important to put that out. I think it's also important to mention that to the credit of the senator from Berthoud, he has been very willing to work with us and try to strike a compromise here. So I'm very grateful for that. Finally, this issue came to my attention before March, the beginning of March, but we had a town hall meeting in Larimer County in Fort Collins on March 10, and there were about 15 individuals who showed up who specifically wanted to talk about this issue. 5 of those individuals were owners of small assisted living residences in Larimer County, and then the rest were family members that were being served. And so after the town hall meeting, we sat down for over an hour and we discussed some of these issues. And so as a result of being informed of that, we did contact the department. We helped to facilitate a conversation with a lot of folks around the table. I was there. The good senator from Berthoud was there, as well as one of the state reps from Fort Collins. And so we've been trying to facilitate a process here. And then, of course, the resolution appeared, sr18-005, and based on the discussions, we've come up with this L002, which in our view, and I think all 3 of us, represents a better balance. It also acknowledges, for example, that we have approximately 660 of these assisted living residences, and 60% of those are serving folks under 20 residents or fewer, and many of those people, 40%, are folks that are on Medicaid. And I see that the good senator from the Joint Budget Committee is over there. he's probably going to speak to a point that in the resolution that I was going to speak to, so I will defer to him when it is his time. I rise in support of L002. Thank you.
Senator Moreno.
Thank you, Mr. President. Colleagues, Senate Resolution 5 is introduced. I had planned to vote no, but I do come to speak in strong support of Amendment L002. This amendment would allow for more time, but I think elaborates on the importance of assisted living facilities, but also what the Joint Budget Committee did this year to increase the provider rates for these facilities. They will be receiving a 25% provider rate increase, which translates to about $4,700 per year per resident. Obviously, these are folks that had lower than needed provider rates under Medicaid, and we saw the value in increasing those provider rates, but part of increasing those provider rates is also making sure that they are compliant with safety and the proper care of the people, the very vulnerable communities that reside in these facilities. And so, we were happy that we were able to increase the provider rates for this very needed service. But at the same time, we want to make sure that the proper regulations are in place to ensure safety and ensure that everyone is being cared for properly in these facilities. So I encourage your support for Amendment L002.
Senator Lundberg.
Thank you, Mr. President. I will try not to belabor the discussion too much. I will reserve just a few comments I want to make once we get through the amendments. But in short, I will support this amendment. I cannot say that I'm fully in agreement with it, but I believe that it has, I trust, reached a reasonable compromise so that the resolution can move forward, and we, the Senate, can say to the Department of Public Health and Environment, please go slow and think very carefully on what you are doing to the smaller facilities. Again, I will support this amendment, and then I will ask for a minor modification to the amendment with a further amendment.
Senator Martinez-Humenick.
Thank you, Mr. President. Colleagues, I rise in support of this amendment, L002. I was a part of these meetings, and these meetings have been going on for 24 months, and they actually started months before that. The small assisted living facilities were a part of those meetings. However, the representatives only attended 40% of the time, and there were monthly meetings for 24 months where they spent ample time going over this, hearing everybody's concerns. So this is the first complete review redraft since the original rules were put into effect in 1986. And there were a total of 36 meetings, approximately 5,200 plus volunteer hours that were documented by the members of this committee that were there. The public could have attended, and if you couldn't be there, you had the option to call in by phone, which is what I did when I had conflicts. There was HCPUF representation for this entire time, this 2-year stakeholder process. They believe that Medicaid patients, this group, decided that Medicaid patients should have the same level of services as the private pay clients. Facilities Guidelines Institute standards are the national standards designed to preserve the quality of life in these facilities. The department has responded to specific concerns that were raised by the stakeholders, and I was at those meetings. Those were addressed. Instead of meeting the FGI parking requirements, our assisted living facilities are authorized to meet local zoning requirements, which is whatever their city or community or county has put in place. Facilities with 10 beds or less do not have to meet the elevator or bathroom requirements that are in the new rules. And what I wanted to just let you know is that we've had some complaints. The facility size of 19 beds or less, with a number of beds totaling 4,001. Facilities with 20 beds or more had 18,480. So we've got complaints here. What most people don't realize is that the only thing that is licensed right now currently is the building itself. Everything else is done by rule. So our assisted living residents in Colorado are now becoming older, and as they age, are having more complex healthcare needs than we had 30 years ago. 57% of these assisted living residents in Colorado are over the age of 85, with 25% 75 to 85 years old. 50% may have cardiovascular disease, 43% Alzheimer's or some form of dementia, and that is increasing. 28% have been diagnosed with depression, and 15% have been diagnosed with diabetes. So with the numbers that I just gave you, the small facilities demonstrate double the rate of complaints per bed than the larger facilities do. The small facilities were involved in these conversations. We had many, many members from the Alzheimer's Association. I can actually go through the list and tell you who's on the committee. There were 34 to 35 people that showed up every single time that were actually on the committee, as well as all of the stakeholders that these new rules will affect. So there has been time, very careful, thoughtful process in the engagement of the stakeholders for the last 36 months on revamping these rules. So the 4 months for implementing this is plenty. It doesn't need to be any more than that. The fact that the small facilities were at a town hall meeting in one specific locality, that's fine, but they had the opportunity to have their voice heard, either in person or by phone. So they were able to be a part of these committee meetings, the rule reviews, the discussion, everything. And if they chose not to be, or they chose to have their representative there, which, by the way, their representative did vote for the adoption of the rules that will be put before the board tomorrow. So I am in favor of L002, and I would just say that because we have safety issues, healthcare concerns, quality of life issues, I could tell you stories about some of the facilities that I have been in. When you have people who are not even CNAs, MAs, or nurses dispensing medication, that's a problem. When people's medication has not been ordered properly and somebody has been without their meds for 2 weeks, being told, we'll just let you know when it comes in, this is part of the 40% that is driving 100% of our rising healthcare premiums for everyone else in the state. Everyone in an assisted living facility has the right to dignity and quality of life where they're there, and their family members should be able to have confidence that when a loved one or a relative or a friend of theirs is placed in an assisted living facility, that they will be taken care of correctly, appropriately, expediently, so that they don't incur other health care issues. This is also a problem in our smaller communities. Sometimes these communities have no other resources but one. And I was actually in one where I wrote 3 pages of things that I saw that either were done or were not done for the people who lived there. And I had to have a relative in this particular facility. And when talking to a nurse who was at the hospital, we had another relative that went to the hospital while I was visiting there. She said she had worked there, and she said, whatever you do, get your family member out of there as quickly as you can. So these rules are needed. We've needed to update these. Again, it's been since 1986 since they've had a huge overhaul of this. And every single one of us in this room may either be in a position to put a family member, a loved one, or a friend, if we're the guardian, or ourselves into one of these facilities, and we should all have the confidence that they are being run correctly, that they are taking care of the people who live there, and that people who live there are safe and have a good quality of life, because it is very expensive to be in assisted living facilities. They actually also need some funding to increase the number of folks that they call surveyors, who are really inspectors, to go out and inspect these facilities. I think it's noted in the resolution L002. The federal government provides funding to ensure that Colorado's 228 nursing homes in which residents require around-the-clock care are regularly surveyed for safety. And the department has 46 inspectors that do this specific job for the nursing homes. However, they don't receive funds from the federal government for our assisted living facilities. So I would urge an aye vote on L002.
Senator Crowder.
Thank you, Mr. President. I'm going to be supportive of not only the bill but the amendments, both of them. But meeting, just because 36% of the people met with CDHPE, anybody that's had any experience with CDHPE, there's no sense in going to meeting after meeting and hitting that roadblock and hitting that brick wall every time. So I can see that. But what we're looking at here is the ability for the 651 small assisted livings to continue to operate. I do believe that the regulations that they have come up with are far too exceeding what we need. But we're not talking about nursing home, we're talking about assisted living. So I'm going to be very supportive of this, but I just come up to defend those people that did not show up at these meetings, because they know what it's like as well as I do. Thank you.
Is there any further discussion on L002? Senator Martinez-Humanek.
Thank you very much, Mr. President. Well, I'm going to come back up and I'm just going to say that, yes, those small assisted living facilities did have the opportunity. They had the opportunity to sit there with that 35-member committee. It wasn't just CDPHE. These are multiple organizations, the state ombudsman from Dr. Cog. I think the lists were actually provided to your desk a couple of days ago or yesterday. So they did have a chance to have their voices heard. They did have a chance to be a part of the discussion, and these were not short meetings. These were meetings that went pretty much all day. So again, these smaller groups had a representative. They only participated 40% of the time, even though they could have called in from their own facility and participated in the meetings or listened to them and offered suggestions as well. So the fact that they are saying that they were cut out is not correct. And I know that because I attended these meetings and I listened into these meetings myself.
Is there any further discussion on L002? Seeing none, the motion for the body is the adoption of L002. Are there any no votes? With 35 ayes, 0 noes, 0 absent, 0 excused, L002 is adopted. There is another amendment on the desk. Mr. Carpenter, please read Amendment L005.
Amendment L005, just in Resolution
Senator
5.
Senator Lundberg. Berg.
Thank you,
Lundberg?
Mr. President. I move L005, and don't ask that it be read. If I could just describe it briefly.
Please continue.
Thank you, Mr. President. We've had a very thorough discussion on the amendment that was just adopted, which is, in fact, the resolution. The only substantive change that this amendment does is it extends the 4-month period that we're asking CDPHE to hold off on the implementation of these regulations on the small facilities to 6 months. And I ask for its favorable adoption.
Is there any further discussion? Senator Aguilar.
Thank you, Mr. President. I apologize. We actually would have liked lines 6 and 7 struck from this amendment. They are still in there, and so I'd ask for a no vote on L005.
May I have a senatorial?
Senator Lundberg.
Thank you, Mr. President. May I have a senatorial 5, please?
Being a senatorial 5. Lundberg.
Thank you, Mr. President. My apologies. I withdraw Amendment 5.
Amendment L005 is withdrawn. There is another amendment on the desk. Mr. Carpenter, please read Amendment L006.
Amendment L006, Senate
Senator
Resolution.
Lundberg.
Thank you, Mr. President. I move Amendment 6, which is the appropriate amendment that does what I said 5 did.
Senator Kafalis.
Thank you, Mr. President. We rise in support of Amendment L006. This is based on our conversations. It does keep some provisions in that was being asked for by the small assisted living residences, but it also keeps in the references to the provider rate increase, the 25% provider rate increase, and some other aspects. So we are in support of Amendment L006.
Senator Martinez-Humana.
Thank you, Mr. President. I will be supporting L006. However, I do have a concern about striking the 4-month time period that this is going to be delayed to 6-month time period. Folks, we have had people that have been sexually assaulted. We have had people who have not gotten proper medical care. We have had a resident that was bludgeoned to death by his roommate. Delaying these rules going into effect doesn't help the people who are actually living in these facilities. But I am going to be in support of this. I'm just letting you know I don't like the 4 months going to 6 months, and that's just putting our citizens who are assisted living residents at risk.
Senator Kafalis.
Thank you, Mr. President, and thank you for the discourse. Just to clarify, and perhaps the sponsor of the amendment can correct me if I don't have this right, because we kept the 6 months, but we are not talking about the rules will be adopted by the Board of Health tomorrow, and that's why we're discussing this resolution today. And we've also in L006 we put in a date where the revisiting of some of these rules would start May 15th, and if you push that out 6 months, that gets us to November. But I don't believe this will put people at risk, because the rules will go forward. This just gives an opportunity for the assisted living residences, the ones that serve less than 20 people, will have an ability the opportunity to meet with the department and other stakeholders to revisit some of the rules as they pertain to small ALRs. Thank you.
Senator Lundberg.
Thank you, Mr. President. Yes, I agree.
Is there any further discussion on Amendment L006? Seeing none, the motion before the body is the adoption of L006. Are there any no votes? With 35 ayes, 0 noes, 0 absent, 0 excused, Amendment L006 is adopted. Senator Lundberg.
Thank you, Mr. President. I'll try to be brief here, but I do want to answer a couple of concerns so as to clarify what we're actually doing. Again, the original amendment that we did pass was a strike below, and I characterize it as the original amendment was a loaf, and this is a couple of slices left, to simply ask the department to think a little more carefully about this. And I want to refer to everyone again the letter that I put on your desk that is simply an example of one individual who owns 2 small assisted living facilities, who is stating outright, if you look at all of the regulations that are being put in place and will presumably be adopted by the board tomorrow, he'll be going out of business. We have somewhere between 600 and 700 small assisted living facilities across the state. My concern and my reason for bringing this up in the first place is that these are good facilities. Now, you've heard some concerns given. Let me give you 30 years ago, we talk about the last 24 months we've been looking at this. Well, okay, good. 30 years ago is when I first became aware of the small assisted living facilities. That's when I put my mother in one because she had Alzheimer's. And we searched for the very best situation for her, and we found it was the small assisted living facility. And why? Well, particularly when you have dementia, the people who care for you need to know you. And in a small facility, there is a very small staff, which, by the way, is why they can't make these meetings. because they have a small staff, and they are busy 24/7 looking after these people in a very self-sacrificial way. Anyway, we placed my mother in a small facility and found it to be excellent care for her. And I have ever since followed this very carefully. And when I entered the legislature 16 years ago, one of the first pieces of legislation I ran was concerning the small assisted living facilities. And consequently, I became associated with a lot of the facilities around the state, and I discovered that it's really tough for these folks to stay in an organized fashion, which is where the stakeholders come from. No, these are small operations, and they are the very best care for people who need that 24-hour care in just about every situation. Now, you heard, well, it's getting worse now. I can tell you that my mom, 30 years ago, needed a lot of care. Yeah, had she been left to wander on her own, she probably would have been one of those who would have been found dead somewhere. But that didn't happen because they knew her. And actually, on a couple of occasions, she did have to, due to some medical issues, go to a larger nursing home setting, skilled nursing home setting, for recovery from some medical issues. And that's where she almost died. Why? Because of lack of adequate care, because they didn't know her. I'll tell you, when some member of your family comes down with that awful disease of Alzheimer's or some similar dementia, you will begin to understand how vital it is for their caretakers to understand who they are, not just to be one of a staff of 20 or 30 that rotate in every 8 hours. No, I am carrying this, and these last few paltry slices of this loaf, which was just requesting that CDPHE take a little extra time and look at this a little bit harder, because it is going to close down and make it more difficult and make it more expensive. And let me add one other element too, because it is true that we bumped up the Medicaid coverage for assisted living by 25%, which is huge, except for the fact that the Medicaid support for assisted living is a fraction of what it is for skilled nursing. I'll just give you the number for my mom. And we supported her in this back then. There were no Medicaid beds available that I'm aware of, but we were paying $1,800 a month. And again, this was a quarter century ago. When we had to rely on Medicaid, the assisted living facility was not available because they were not Medicaid covered. Instead, it was the skilled nursing, which was really no better care. It was adequate, but no better, no different really, except the larger group, of course. It was twice that cost, and that's what it is today, too. Skilled nursing care is twice the cost as assisted living facilities. So to bump up, and I think eventually when the care came, or when Medicaid beds were available, it was like $1,000 a month, even though the actual cost was twice that. So our bumping it up by 25% is just taking it up from a below-level subsistence to a subsistence level. Anyway, I will trim my thoughts at that and ask that we pass this to simply ask the Department of Health to go slow and recognize that they are jeopardizing a vital service for the people of Colorado if they fully implement all of the rules that they are most likely to adopt tomorrow. Thank you very much, Mr. President.
Is there any further discussion? Seeing none, the motion before the body is the adoption of Senate Resolution 5. Are there any no votes? With 35 ayes, 0 noes, 0 absent, 0 excused, Senate Resolution 5 is adopted.